Brianna, and I'm going to be talking about leukemia. So I made this pamphlet to help guide us with the information. So first off, we're going to start off with what is leukemia. Leukemia is a rare type of cancer that occurs in the tissues that form blood, like bone marrow. This disease allows people not to fight off infections correctly, and it involves white blood cells, which are mass produced, and inhibits the red blood cells that are produced by bone marrow, which is not good. So here in this picture we have normal blood cells, what they should look like, and then what the leukemia cells look like. And I made these to help visualize it. So here we have normal. As you can see, there's a lot more red blood cells in here than there are in this one. And as we can see in this one, the leukemia one, there are a lot more white blood cells than there are in this one. So next we have what are the symptoms and effects of leukemia. So I decided to make a little montage of some of the symptoms. So I'll play that now. Pain in bones and joints, dizziness, fatigue, fever, loss of appetite, easy bleeding and bruising, frequent infection, mouth ulcers, pale skin, red spots on skin, shortness of breath, swollen lymph nodes, weight loss, weakness. So now we're going to talk about the two main categories of leukemia. So the first one is acute leukemia, and then there is also chronic leukemia. So under each of these categories, there are two different types of cells that are affected. The first one is the myeloid cells, and then the other one is the lymphoid cells. So starting with acute leukemia, this is when the blood cells are abnormal and produce very rapidly, and they are also immature. So under that, there's acute lymphocytic leukemia. This affects children that are under the age of 5, usually, and then adults that are over 50. Also, there is acute myelogenous leukemia. This is a very rare type of leukemia and is more common in adults than children, and is more common in men than women. So under chronic leukemia, chronic leukemia involves mature blood cells that produce too many cells while others don't produce enough. Then there is chronic lymphocytic leukemia. This is most common in 55-year-olds and in younger adults, and it mainly affects men and is very rare in children. Then there is chronic myeloid leukemia. This develops in adults mainly and is also rare in children. So now we're going to talk about how leukemia is acquired. So there's no specific cause of leukemia, but some thoughts are that it may be genetic or some environmental aspects take part in it. So what may lead to people developing leukemia? Some aspects are family history. So if a family member has it, you are at higher risk to getting it. Some high levels of radiation, you may get it. Smoking, drugs, and some genetic disorders such as Down syndrome. So are there any prevention or methods that allow you to not be at as high of risk to get leukemia? So not really. There's just avoiding some environmental things like tobacco products or certain chemicals. Next, we're going to talk about some common treatments that are used to help treat leukemia. So the first one is chemotherapy. This uses chemicals to target the leukemia cells. The next one is targeted therapy, which uses drugs to target the cancer cells and kill them. Also, there is biological therapy, which uses your immune system to attack the leukemia cells. Then there's radiation therapy, which stops the growth of your leukemia cells. Then there are stem cell implants, which replaces your diseased bone marrow with healthy, and you can either have a donor or you can use some of your own healthy stem cells. Then what are the systems that are impacted by leukemia? So leukemia spreads into the lymph nodes, spleen, liver, central nervous system, and possibly some other organs. The lymphatic system is largely impacted, and it contains white blood cells, also called lymphocytes. These are found in the lymph nodes, and when it is spread to the lymphatic system, it causes your lymph nodes to become swollen and enlarged, and it also enlarges the spleen and the liver. So then we have how many people are affected by this disease each year in the US, and that number is fewer than 200,000. Lastly, I have my references, and that will conclude me informing you all about leukemia.